Hello, everybody. So I'm James Arkinstall, I'm the head of comms for DNDi. Don't be fooled by the MMV branded footwear. So I am here to talk to you about a project we're midway through on, which started off as a fundraising campaign and ended up into a media awareness campaign. So it's a bit like when you print off a map of the Barbican, you try and think you're going in the right direction, you end up where you first started. But hopefully there's some lessons in all of us for this. So the DNDi, if you're not familiar, is similar to MMV, is a product development partnership, non-profit for R&D on NTDs, about 8 NTDs. So I'm going to be talking about sleeping sickness. So not so long ago, about 10 years ago, in fact, the most commonly used treatment for sleeping sickness was known as milsapril. It's an arsenic derivative. It's extremely painful for the patient. And you might have heard of the expression fire in the veins. That's the way that various people described the experience of having this treatment and how painful it was. It's also extremely toxic in the fact that it killed 1 in 20 people who were put on treatment. So there were other treatments available, or in existence, rather, but they were not necessarily registered in the countries, or their production had been discontinued because of a lack of a commercial market. And so sleeping sickness is very much the epitome of a neglected disease, in the sense that the treatment options 10 years ago were extremely unsuitable or unavailable. Flash forward to 2009, and you have the first step forward, which is NECT, which is a combination of 2 existing treatments. So it's not a new product, but it's a combination of existing products that are made better and more suitable. And it's actually extremely effective, and it's brought caseloads down considerably, but it's got 3 major shortfalls. The first top left is the fact that it's extremely burdensome and cumbersome. It's extremely heavy. Eflornithine comes in infusions, so it's glass bottles, it's heavy, it's difficult to transport. That's someone lugging literally the box through the Congolese bush. The second shortfall, bottom right, is that it only works for stage 2 of the disease. And so in order to figure out whether the patient's going to benefit from NECT, you need to do a lumbar puncture, which is obviously not the best of things to be doing in the middle of Congo. It's extremely painful for the patient, and it's a burden on the health systems. And then bottom left, it requires hospitalization. So again, that's a loss of revenue for patients. It's 14 days, if I'm not mistaken, in hospital, an extra burden on the health systems there. And so what we're hoping to do is move from this situation to this situation. This is fexonudazole, which is a new drug, which is currently in phase 3 clinical trials in the DRC and the Central African Republic. And as you can see, it's in a pill form. It's 10 days of treatment. You can see there's 10 circles, 6 orange ones and 4 green ones. If inshallah it will be registered, it will be produced by Sanofi, our industrial partners on this. And it actually circumvents or overcomes the 3 problems I described earlier. So it's obviously not bulky because it's 10 days of treatment in a pill format. It works for both stages 1 and 2, so there's no need for the lumbar puncture. And potentially, it can actually be done outside of a hospital setting. If you can see the scribbling at the top, it says patient 0001. This is actually the first patient on ongoing clinical trial at the moment who took it in ambulatory outpatient fashion and brought the pills back, the packaging back, to show that they'd taken it. So potentially we might be, in 2018, at a situation where we have an oral treatment for sleeping sickness, 10 days, and which would be a fantastic, solid basis on which to go for sustained elimination for sleeping sickness. So that's for the contextual picture. Where we would never have got this far without this fantastic support from our donors, many of whom are in the room actually today, so thank you very much on behalf of DNDi to them. But we were trying to broaden that fundraising base and try out a new strategy by going to high net worth individuals, as the jargon calls them. So this is a closed door, although that sounds somehow a bit sinister, a private sort of contact to contact. Would you like to cooperate and fund and help us get these treatments out of the final stages of the clinical trials and into the patient's hands? And we were hoping to very much use a human angle, very much talking about the benefits and not a scientific jargon, but looking at the real benefits and the people affected by this. So this, for example, is a mother in the Central African Republic who's come for screening for her daughter, I presume. And so we devised a sleeping sickness fundraising campaign. Again, this is not public. It was a brochure and a mini site as a support to approach people that might be interested and that we thought might be potential big donors. And you can see some of the targeting in terms of the messaging. It's very much appealing to people's ability to contribute to making history. You can sign a check and cross out sleeping sickness. And we had a $5 million benchmark as a target, and the idea was that we get to a certain percentage and then go public and ask the man on the street and the woman on the street to contribute for the final elements. And then this is where the Barbican factor came in, because we contacted the Huffington Post on a fundraising basis, not as an awareness campaign basis. And the answer that came back from them took us in a very, very different direction. You might be familiar with Joe Confino, who was the executive editor at The Guardian here and set up the Guardian development pages in the Katsina Ugandan village. Those of you who work in media will probably remember that. So he's now at the Huffington Post, and he came back with a proposal, which was that he had just negotiated a grant from the Bill and Melinda Gates Foundation for a year-long project reporting on neglected diseases. So not just sleeping sickness, neglected diseases, all neglected diseases. And his proposal was, why don't we just take some of your messages and some of your storylines and use this as the sort of the front piece of this campaign. So Project Zero, I'm sure people are familiar with this and this. If you haven't looked at it, it's an extremely good resource for this community. And there is a fundraising element to it, which is, as you can probably remember, very much based on the DNDi materials, but it's obviously a public one. So we've completely torn up our fundraising strategy and gone for a public approach. It's obviously not raising vast sums of money, but the public awareness component that went with this is so good an opportunity that we thought it was best to sort of start over and join them on this fantastic adventure. So there's a CrowdRise site where people can share on Facebook. It's very well embedded with social media functions. And here are some of the stories that are coming out. So very similar angles to what we were proposing at the beginning in terms of like looking at it from a human perspective and telling the story in very much non-scientific. On the left, you have a Congolese doctor called Dr. Matubu, who works for DNDi. He is one of our principal investigators in the DRC. And on the right is an American man who worked for USAID and came back to having contracted sleeping sickness. Sorry, I've been talking out of the mic's range. Having contracted sleeping sickness in Chad, went back to the US and was found to be the 21st patient that America had ever seen in sleeping sickness. Now, at the top, you've got the sharing numbers, but in terms of like actual hits, the one on the right, I don't have the absolute numbers, but the one on the right was 50 times more successful than the one on the left, and that's obviously because of obviously the catchy title helps, but also the empathy and the fact that it's very much at home. It's a story that you can relate to, and so the next step of our collaboration with the Huffington Post is to try and get some of that empathy from our clinical trial sites in terms of content development. And Huffington Post will be going to some of the clinical trial sites here to do some virtual reality and some drone footage. Now, unfortunately, if this conference had been 3 weeks later, we would have been able to show you some initial rushes from that, but instead you get a boring map of Africa. So I'm afraid that's the best that we can do at this stage. But I think in terms of lessons learned for us, I think it's, don't be afraid to, tear up your song sheet and start over. We're hoping to find out a lot more about, whether virtual reality and that kind of thing can actually bridge that empathy gap that I was talking about. We've got someone talking about virtual reality in a minute, so hopefully that point might be addressed. And then on a very, very simple basis, it's don't ever say that you're going to do drone photography to the DRC Ministry of Communication aerial photography works a lot better. So thank you very much.